Welcome, everyone, to episode 1 of the CSI Intel Brief, Providing the Facts to Act, a podcast exploring how investigation, intelligence, and human-centered engagement help organizations bring clarity to complex situations. In this episode, we're going to be talking about Family Connect, rebuilding family visibility from day one. In today's episode, we'll explore how child welfare systems can strengthen early decision-making by improving family visibility from the very beginning of a case. Across the country, state and county systems are facing enormous pressures, workforce shortages, rising case complexity, placement instability, and increasing expectations for prevention, all without expanded resources. One of the most persistent challenges: systems are often making critical safety and permanency decisions with only fragments of family information. Today, we focus on a model designed to address that gap: Family Connect, CSI's evidence-informed family search and engagement framework. Family Connect isn't a one-time search, it isn't software, and it isn't added workflow for frontline staff. Instead, it's a structured approach that integrates investigative rigor, trauma-informed engagement, and technology-enabled verification to strengthen early family identification and activation. Joining me today are Ann Schlegel and Talina Lindsay, who work at CSI and impact the design and implementation of Family Connect across multiple jurisdictions. Welcome to you both.
Thank you. Thank you.
So we're a very interesting topic we're going to be going through, and we'll talk a little bit more about some of the major areas we're going to be going over. But could you both introduce yourselves to the audience, explain a little bit of your background and why you're here and talking about this subject? And maybe we can start with you.
Sure. My name's Ann Schlegel. Child welfare is my passion. That's why I'm here. I've been in the child welfare field for close to 30 years now. I started as a caseworker, boots on the ground in the field, worked my way through there from a supervisor, a program specialist. I served in administrative roles as a deputy and then a director into child welfare agencies here in Pennsylvania. And about 2 years ago, I joined the CSI team as their child welfare senior advisor. And it's really to expand on the child welfare work and what really matters to me and to the system altogether. My decision to join CSI and leave public child welfare was really surrounding the opportunity to make a difference in a much broader sense by developing and implementing and help guiding services that are needed for child welfare agencies.
And it sounds like from your background, you've covered pretty much every angle of the child welfare universe.
I feel like I have. I also feel like there's so much more that I probably didn't, because every day is a new experience.
It's such an important topic. Really looking forward to digging into this with you.
Thank you.
And Talina, can you introduce yourself for the audience, please?
Yes, so I'm Talina Lindsay, and I'm the supervisor of the Family Connect unit here. My background's not as long as Ann's, but I have been in child welfare for about 11 years. I started working within foster care, then I moved up to county. I was an ongoing supervisor for a while. I felt the need to learn to bridge that gap in between the foster care world and the families that we were servicing in the community. And about a year, maybe a year and a half ago, I joined CSI's team, and I had this opportunity to expand my knowledge and grow. Children are my passion. I have 5 kids myself. So I think that it's really important to help the kids in the community and the families build those connections. So my team's pretty much the boots on the ground and keeps us pretty busy.
I'm sure you can't do this job without having a passion for children and protecting them and everything you can do for them.
Yes, absolutely.
That's great. Well, I really didn't know much about this topic until we got together to go through these outlines and sort of discuss what we're going through. And it's fascinating to me, and a lot of what we're talking about makes so much sense. But, generally speaking for the audience, giving them a background of what we're going to go over. We're going to explore why systems lose family visibility. Which is something, again, I didn't appreciate how important that is and what that means to a child's welfare when they're pushed in a tight position. We're going to talk about how to locate, engage, connect, and sustain, and how that works in the practice of what you both do, why paternal kit engagement matters, and how early family clarity changes safety, permanency, and workforce outcomes. So With that as a background, let's start with the big picture. And Ann, I'm going to ask this question to you. What pressures are states facing that make early family visibility so urgent?
I think there's so many pressures, but the one that comes to the top of my mind first for family visibility is really around the needs of children and youth, and how those needs have really intensified over the past several years. The lack of behavioral health resources, the lack of placement options, youth waiting in hospital settings for a hospital bed, or sleeping in CYS offices, child welfare offices, or hotels because placement resources are unavailable. Where if we were able to earlier identify family, maybe some of those things would not occur.
Has it gotten worse?
I feel like it has gotten worse. The feeling is that has gotten worse, and we like to blame everything on COVID-19. But since that time, systems have really been interrupted. Behavioral health systems, mental health treatment, access to services, and just the needs of youth have really increased.
Well, and so this idea of family visibility, which you just
Yep.
mentioned, is something that is so important in making sure that these situations are handled and handled properly. Why does that matter? And maybe start with what is family visibility, and then why is it so important?
Yeah, family visibility is really identifying that family network, that support system, early in a case. And why is it so important? I think everything goes from there. So, reducing congregate care placements, reducing emergency shelter placements, reducing the amount of time that children spend jumping from placement to placement, and lack of stabilization really happens with family visibility. So if you had that family visibility, you would be able to see those reductions in congregate care and resource family, stranger foster care, if you will, placements, because you have that family visibility.
And at its core, correct me if I'm wrong, but this is understanding who the family is surrounding this person, this kid.
Yes.
Okay.
And family in the broad sense of terms.
Yeah.
So when we say family, we're not just saying blood relatives. It's anyone who is important to that child or that family throughout the course of their life. Could be a baseball coach, could be a Girl Scout leader, could be a next door neighbor, a school bus driver, along with all of the blood relatives.
Which I imagine, isn't somewhere you can go to one place to see, oh, here's the picture of who this kid's family is.
Absolutely not.
And so on a boots in the ground perspective, Talene, if I can shift this over to you. So you have the responsibility of trying to pull this all together and identify this. So practically speaking, what's this look like?
So what that looks like for our team is we really focus on finding as many family and kin and supports as we can right away. Because from the county perspective, they're focusing more on the emergency response, the safety of the child, and the placement. Caseworkers are often working under those extreme pressures and time restraints. They're worrying about documentation and making sure that all their ducks in a row. They don't have the time or the tools that we do to access as many family members as we possibly can to help maybe find the supports for the child in the most timely, effective manner. And whenever you're able to access that many family members and make those attempts, we bring them to the table a lot earlier in order to maybe find the most appropriate placement for that child and keep that child connected to their family and to their kinship, which is extremely important.
And I would imagine that the counties and these organizations that are responsible on the front line of responding to an incident, they have to meet their minimum legal obligations first and foremost, which are designed to protect the kids, but aren't necessarily always the full picture of what's best for the child. And is that where you find that what you guys are doing is really supplementing and helping with that?
Absolutely. Our partnership, I think, is greatly beneficial for them and for the families that we serve. We're able to bring a large amount of people to the table and provide that support, however that may look in their capacity, which allows the county to make their decisions and really have that partnership to help them.
That's great.
Mm-hmm.
All right. So, Ann, how, now I understand a little bit better about, how a county may interact with somebody like Talina and her team, or you that are out there, but how does CSI specifically define its role within these state systems?
Yeah, so CSI does not see itself as the system itself. We are a extension of the system. So we provide that additional support. We provide the information that county child welfare agencies need in order to make informed decisions.
Okay. And Talina, with what Ann just said about how CSI sort of integrates into these state systems, not replacing them, but supporting them, how does this help the frontline staff?
So it really helps to reduce the burden from the county casework team to be able to not only locate those individuals for that family, but through our investigators and our engagement specialist, we're able to focus on the pieces that take up the most time. And that's really those in-depth conversations with family members and with kinship, and it could be, like Ann said, it could be teachers, it could be a coach that child feels very close to. It also allows the caseworkers to spend more time working directly with the child and immediate family, rather than spending their hours trying to track down information and contacts and make those initial conversations to bring those individuals to the table.
So, is it fair to say that what part of the problem is it's an information gap for those frontline workers? They don't have access to everything that you can bring to the table immediately for them to make potentially the best decisions in the interest of the child. Is that fair to say, Ann?
I think that's fair to say. I think the other part of it too is that child welfare notoriously works in crisis. And even from the early stages of an intake case. So that's usually when family clarity breaks down, is usually right from the front. And rightfully so, the system, the caseworkers are focused on safety, the child safety being number one at all times. And when you're focused on safety, you're doing the parts of the work that require you to do in order to ensure that safety. The next step is always, okay, now what? Now where's this child going to be placed, or who's the family that can help support? And that's always the afterthought after safety. But unfortunately, it has to all work together. And right. In order to build that family system, you're ensuring the safety of that child as well. But in those intake stages, when they're working in that crisis, there's just not the time, the ability, or having the tools available to be able to quickly find that kin or those resources.
And I would have to imagine in many of those situations, the child themselves are either incapable of giving the right information or don't know the right information themselves, necessarily looking at it in that way. And so you said their primary concern is making sure they're safe and secured. And you can't just say, oh, well, this kid's going to tell me what I need to know in terms of the right family connections.
Right. I would say the child or the parent.
Yeah.
There's a lot of emotions heightened at that time. And, sharing that information about your extended family does not seem like the thing you would want to do as a parent when you're in that crisis. Some folks don't want their families to know what is happening with them. So you cannot rely just on asking the child or the parent.
Yeah, anybody, I'm sure it's an embarrassing and scary situation for them. I would imagine family members are afraid of what it means to answer any questions sometimes.
Absolutely.
Yeah. Mm-hmm. All right. So Ann, let's move on to sort of the next segment of this episode, which is sort of identifying the problem. So where does family visibility typically break down?
So, as I had said earlier, family visibility typically breaks down in the intake stage of the case, the beginning of the case, the investigation stage, where the focus is on investigating whether that child is safe and whether the incident or the maltreatment actually occurred. And it's really focused on that investigation stage rather than that broader family network.
And so we know from what you've described, and it makes sense that intake is a critical stage. I mean, what what does the system typically know at intake? What is available to them?
Yeah, initially the system typically knows what's on the referral. It might be just basic demographic information of who's all living in that household that child or youth had resided in. Um, Possibly a parent who maybe is not living in the household but has contact or a connection with that child. It may be the reporting source who knows this child in some sort of way. Other than that, there's not much information available right off the bat. It's up to that intake worker, that investigation worker, to go into that field, investigate the information that was on the referral, and then try to determine whether or not there's additional um, folks, family who can help support.
So they're really limited to what's in that report at that time, and they're again, primary concern is safety and security for the child, and the investigative piece is secondary for them at that point.
Right, they're time limited in their own work as well to complete that investigation, and that family clarity or family connection is not part of the investigation process.
Okay. And I got to imagine this is frustrating for them a lot of the times because they're put in that position of knowing that if they had all the resources and time in the world, they could do more right then and there, but they don't. And Talina, I'm sure you're dealing with this a lot. Could you talk to us about what is that workforce reality for the caseworkers? What's that look like for them?
So the reality for the caseworkers is they're really trying during that stage to reconstruct the family unit while managing everything else that they have to prepare for during that case. Some of those responsibilities include court preparation, documentation. Of course, documentation of every single step is crucial. Placement coordination. Where is this child going to go? Who do we have access to and who's appropriate? Any service referral needs that child or family might need, and of course, ongoing safety monitoring. When the workers are carrying such full caseloads, it becomes pretty difficult for them to conduct that investigative and engagement phases that we are capable of doing here at CSI to build that child support network and family network. Because of these pressures, family discoveries tend to happen over time instead of that immediate, like our process is 30 days. So examples that we see frequently that we run into are fathers who are not identified until later on down the road, and it could be months later. An aunt or a grandparent that learns of the situation long after it's already occurred and placement decisions have already been made. And relatives usually surface later on down the road who could have been possible placement options or supports for that child that were not identified in the beginning.
And that's got to be frustrating for them. There's a lot of T's to cross and I's to dot, it sounds like, that keep them busy, without being able to do any of the meaningful investigative work that you're coming in and helping with.
Absolutely, yes.
Okay. And Ann, is some of this due to system design problems? Does that play into this at all?
1,000%.
Okay.
It's absolutely system design process. It's the way the system's set up. You start with an intake, you start with an investigation, which is focused on safety and doing that investigative work to determine if an incident of abuse or neglect has occurred. The structuring of the family system, the way the system is designed, doesn't occur until after the family has already been accepted for service, and you're starting to do that case planning and permanency planning, where really that whole thing needs to start right in the beginning. Family, looking for family to support in order to divert families from the system would be the way that the Family Connect model would function, is really to build a whole new system design where you're working upstream and you're getting that family clarity from the beginning. And imagine the ripple effect that would have on the cases going through. I mean, you would not have children placed in emergency temporary placements. You would have families being able to be diverted from the system because they have that family supports coming together and being able to support that family out of crisis. You would have paternal, Talina had mentioned paternal family, fathers, identifying those fathers early, identifying paternal family early, in order to provide that additional support to help families get out of their own crisis and not have the systems have to do it.
And I have to imagine it's hard to reverse some of these decisions once they've been made.
Correct.
You know?
Correct. I mean, if you don't have all the information to make a decision, to make an informed decision, then you're just making decisions based on what you have. And then information, as Talina said, comes later down the road. And now administratively, court-wise, those initial decisions are being now reopened and challenged because more information has come forward as we go through. I think of a case I had, towards an adoption stage. A child was ready to be finalized by an adoptive family that they were with for over 2 years. And family was identified later on in the case. They didn't know this child was in care, and it disrupted the process for a child and the adoptive family and the birth family as well.
And I always say that the wheels of justice are greased with molasses because it moves slowly.
Absolutely.
And if you have to go back to a court or petition a court or get a court date, I mean, that alone is going to be weeks, if not months. And I can see how making decisions that you have to make to place a child somewhere, make sure they have a roof over their head and food in front of them is going to be tough to reverse if you don't have that information at hand.
Knowing that the cost that was to the system.
Yeah.
So you're thinking of a child who might have been in a congregate care placement before, and the cost of that congregate care placement, the court's now going to want evaluations done by a trained professional to determine the best interests of the child of uprooting from a home they've been in to going to kin. So again, the cost that is associated when decisions are not made with full information at the beginning of a case.
Right. Absolutely. You can see that. And as part of this, because investigations engagements are often treated as separate?
In my opinion, yes. If they work together, you would have the full picture at the beginning.
And this is the concept behind Family Connect.
That's correct.
That this is done at the beginning, as close to the beginning as possible, so that the information to make these decisions is in hand as quickly as possible.
That's correct.
Okay. So, and can you talk a little bit about the historical development of the roles?
Yeah, absolutely. So Family Connect really combines several elements that are often separated in child welfare. So as you said, the investigation, the family engagement, field-based expertise. That was the thought process behind how we were going to do the model. What we talked about up until this is the reasons why it's important to have the model. So our Family Connect model was broken down into 4 parts. It's locate, engage, connect, and sustain. In that locate stage, our trained background analysts and our investigators are helping to locate, identify, and verify possible kin outreach for children and families. So within several hours of when we get referral to maybe even a day, we're able to provide county agencies with a list of 50 to 60 kin right off the bat of who is a potential kinship support for this child or family. So again, our locate stage with the training that we have with our background analysts and our investigators, we don't just hand the county a report of names and phone numbers. These are information that we've verified through all of our databases and all of our resources and all of our trained staff to verify that these are indeed kin. And then we move on to our engage stage, which is the stage that Talina oversees.
So Talina, Ann just described that the processes for Family Connect are locate, engage, connect, sustain. And she just described the location piece, which is, identifying who are potential family members that are out there, verifying, who they are. And then this is handed over to your team to take on engage. So what does that mean?
So the engagement piece is really, really critical and crucial. It's about reaching out to every single individual that we've identified in a thoughtful and respectful way. It ensures family members, we have some deep-rooted conversations. We make sure that they are understanding the situation, and they also understand the role that they might play in supporting the child and or sometimes the family. Engagement focuses on building trust and having open, honest communication with those family members to participate.
And I would imagine, and we talked about this earlier, that there's probably a lot of hesitation from, especially if you're viewed in any way, shape, or form as being part of, law enforcement or the court system or whatever. There's probably families that are going to be hesitant to talk to you. I have to imagine that's a skill set that takes a while to be able to break through that in that engagement process.
Absolutely. There's a lot of trauma-informed conversations occurring daily.
Yeah, that's a tough piece, and you have to have the right personality for that, I'm sure. We had locate and engage, and then next is connect. Talina, you want to talk about the connect piece?
Yeah. Connect is probably my favorite one besides engagement, because that's where we take those conversations and we begin to translate them into meaningful relationships. How we could build those relationships with those kinship family members who are expressing their willingness to want to be involved with the child and the family. Of course, some of those conversations include kinship placements, any supportive family involvement, and even participation in planning for the child's future. This could look like, team meetings that the county maybe holds in order to see who could do what with that child to be able to wrap those services around them. The goal is to really strengthen the child's network and sense of belonging within their family unit.
And it sounds like this is really an important piece, because you're not just handing over information, you're handing over a potential plan.
Absolutely.
Okay.
Mm-hmm.
And then the last stage is sustain. Is that correct? Okay. Yeah. So Anne, why don't you tell us a bit about what sustain means?
Yeah, I think sustain is probably just important, if not more important to the system as you think about the life of a case. So sustain is really about that family visibility not disappearing. So in child welfare, unfortunately, there's a lot of turnover. So a worker leaves, that information that worker had is gone,
right?
Or buried deep into a case system somewhere. Our sustain phase makes that family visibility maintain their visibility. So we continue to ensure that those family relationships are always visible to that team.
So all this work that's been done, that last phase is to make sure it's got stickiness. It stays
That's
with
correct.
that child.
That's correct.
That's critical. And I know software is, I'm sure, a part of what goes into this, but why is this not just a software process?
Software can't do what we do.
Yeah.
Yeah, we have that human-centered element to it that software just can't do. Software doesn't have investigative judgment. It doesn't have thoughtful outreach. Software doesn't coordinate follow through, have those trauma-informed conversations that we have, be able to talk to kin for hours who are crying on the phone about their disconnect with their kin, or walk through with a county caseworker the importance of connecting a family together. So, software, that's why it's not just software.
And I'm sure any caseworker who's on the front lines has probably been through situations where an organization has said, well, we got this shiny new piece of software. Doesn't that solve all your problems? And it sounded like that's a small piece of the equation.
That's correct. That's only one piece of the equation.
Yeah. So, Talina, can you talk a little bit about the human element of all this? And I think that this builds off of the idea that software is a tool, but probably not the most important piece of what we have here. So what's the human element? How does that play into this?
So the human element is the most important, like Anne was saying. That helps engagement, and engagement really requires those real conversations. That is a trust building conversation between the engagement liaison and really caseworker and the family members. Many relatives have never interacted with the child welfare system before, which, sometimes poses the uncertainty and I guess the unknown. It really makes them very nervous, which means someone, and it's usually our team, needs to explain the situation, answer any questions that we potentially can help answer. Really learn how to, learn about the family members to understand their family dynamics, and determine how each person may be able to support that child and that family. Those conversations, like Anne said, cannot be made through software alone.
Right. You have to be able to
Yeah.
speak human.
Yeah, absolutely. Yeah.
And probably even more so than that, to be able to calm them down in a situation where you said they're nervous. They might be afraid they're somehow in trouble or afraid of what this means to answer a question one way or the other.
It's a very emotional conversation, because sometimes we're engaging with family members who they might not even know that this child exists.
Right.
So it can be very emotional. And like Ann said, we could be on the phone for an hour, and it is that human element of compassion and being there to listen and to talk them through that.
Yeah, it's just not something you can speed up.
No.
So Ann, with all these pieces in place and the need to tie together the human element with investigative and software, so how's this practice infrastructure work in practicality?
Yeah, I mean, absolutely. We strengthen the operational capacity of child welfare agencies. We're providing them all of the information at their fingertips. We give them a nice packet where it's all right there, who the entire family system is, who's willing to be a support. And it really helps them to be able to make those informed decisions. So you don't have all of that downstream chaos
Right.
following whatever decision they made initially.
That's smart.
Yeah.
So Ann, early on at the very beginning, I mentioned the term paternal kin identification. That was a new term for me. I'm sure something familiar to you both in the space. Can you explain what that is and why that's significant?
Absolutely. So sometimes we think paternal kin is a new term for child welfare staff as well, because it's not something that is heavily pressed even in the intake stage. One would think that it would be very common to figure out who the parents are, mom and dad, from the beginning of a case, but it's not always like that. When child welfare gets referrals, it's a referral on the household, which in the system, more often than not, it's a female figure, a mother, and the children. And when fathers are not identified, if they're not engaged, if they're not having connections with their child or family, they're not a visible part of that family, and therefore are often forgotten. So identifying paternal kin is extremely important, one, legally, because that individual has a legal obligation to his children, as well as the system has a legal obligation to him. But it really expands that entire family network by identifying those paternal kin. What we found in our Family Connect work is the majority of the paternal kin we've identified have been the most willing to step up as supports for that child or family.
So it sounds like, Talina, they're kind of invisible in a lot of instances, and it takes a little bit of gumshoe work to make sure you know who's out there. And as Ann mentions, that opens up a whole line of potential family members willing to step in. Can you talk a little bit about how that works, when you're out there and actually working these files?
Yeah, so our background teams, like Ann had talked about before in the process, they identify, and really our engagement team gets boots on the ground, and we're constantly calling and we're messaging, trying to get in contact with the fathers and their family, which, like Ann said, it drastically expands that support area for that child. And in many cases, like she said, the paternal relatives do step up and they're willing to significantly provide support. And once they're informed and engaged, many are willing to participate in supporting the child in meetings and in any way that they could help the case and the family.
Yeah, I can see how important that would be. That, again, if you're not looking, how are you going to find all these people who may be helpful to that kid's well-being? And Ann, it sounds like there's some system level importance to all this.
Oh, yeah.
Can we talk about that a little bit? Can you explain what that means?
Sure. So we talked earlier about just placement shortages in general. So the system, there's a placement shortage nationwide. I mean, systems everywhere are looking for either foster homes or safe placements for kids who can't remain safely at home. And this really opens up some of those placement options for them. There's limited treatment resources available. There's increasingly complex youth who are really disconnected from, the paternal side that really could offer that support and mentoring to that youth. So, terrific system benefits of identifying paternal kin, not just financial benefits of being able to, you may possibly have this child placed in a lesser cost kinship placement, but really to have that individual to coach and mentor a youth with complex needs.
Yeah, and you can just see that practically speaking, there's going to be a limited number of government resources to place someone, and then if you don't have good foster parents to step in, and even when you have foster parents, they're still a stranger to the child.
Correct.
If you have good options in the family unit, that seems to make the most sense. It sounds like what Family Connect's all about.
It's true.
And can you talk a little bit about, let's move on to the impact of what Family Connect has done. What outcomes have you observed?
Yeah, we have been so proud of the outcomes. We really have seen the amount of family expand for children and for families themselves. The kin who have been able to pull together and provide a whole support network. We've seen more placement options. We've seen increased or decreased time to reach permanency. We've seen children being reunified with fathers that they never even met before. We've seen families diverted from the system altogether because kin are willing to support them. We've seen cases close within the system earlier. I don't know, Lena, if you can think of any others that I might not have.
Well, if we build off of what you said, maybe a child who's never had a relationship with their father before and they're reconnected on that side of the family. Maybe have you seen that in your work where it's actually strengthened the family connections?
Absolutely. Like Ann said, I think that's some of my favorite cases where we've been able to identify a father and bring him to the table. And we have seen reunifications occur that is, we're dealing with not just the county, but different entities as well that work, within that county level. And they come to us and say, thank you. We cannot believe that you guys found him, or, they thought for one reason or another, he just wasn't, he was gone.
Well, and the bigger, the deeper, the more reliable a family unit is to support a child, the less likely they're going to come back.
Yes.
I mean, I think that's very important. And all this is because you're providing better information for the staff.
Yes.
Okay.
Yeah.
And this is you're allowing them to make better decisions earlier because they have the information that they need.
Absolutely. It's better information to guide their work. It helps them really identify and guide their work a little bit more. When the workers are able to understand the broader picture of those family dynamics earlier, they could do a few different things. They make more informed recommendations. As you can imagine, like Ann said earlier, some of those recommendations, the child ends up in out of kin placement, and that's because they weren't able to identify, family members or individuals. They also coordinate with relatives more effectively in order to wrap those services and those family needs around that child, and maybe what might keep them from, being in the system a little longer. And it also plans for the child's future and with greater clarity of, where they're going and what that potential might look like.
Right. So Ann, can you just talk a little bit about how early identification affects the permanency timelines?
Absolutely. And to piggyback on some of what Talina had said, caseworkers do a fantastic job at what caseworkers know how to do. They are trained on how to assess safety. They're trained on how to develop case plans. They're trained on how to make decisions based on risk and safety with the information that they have. They're not trained in what we do. They're not trained in investigating, engaging the kin network. That's what we have our specialist for. So when we give the casework team the facts that they need in order to make the decisions, it really helps to decrease the length of time that children remain in care. We've given them all the information. Children, they're able to ensure that the children are placed in a setting with a kin that is able to provide that support. And it helps children to be stable in those placements, to not move around from placement to placement, which also reduces that length of time in care. So just by having the information at hand, the facts that they need to make those informed decisions, reduces that time in care. Without that, they're guessing
Right.
on what would be best.
And I gotta imagine that's mentally tough on them.
Yeah.
You know, they're trying to make decisions in the dark without
Right.
everything they would love to have.
And they find themselves in chaos
Yeah.
constantly.
Right.
Because when you don't have the right decisions and you make a decision, and that decision, you know, it ends up exploding on you,
Right.
then you're in chaos trying to fix that choice and move to another one.
Right. And obviously the main focus of all this is to support these children the best way possible. But, you know, that's done by reducing burden on the frontline staff. Can we talk about that a little bit and talk about how Family Connect does that? What, practically speaking, are some things that really help the burden of frontline staff and what you do?
Yeah.
Why don't we, I'll ask both of you. Talina, you want to talk about it since you are seeing a lot of this on the ground. Let's discuss it.
Yeah. So like you said, it does reduce a lot of the burden and the burnout because as you can imagine, mostly all counties have, they don't have enough workers and they don't have enough hours in the day. So my team kind of takes that stress off of them. And I know, at first we handed them this list and they said, what do you want us to do? Call these people? We're like, no, we're going to do that for you.
Right.
And I think that that's what they appreciate the most is that collaboration because we have the time and the team in order to contact these individuals to make those meaningful connections. So really that's how it's taken the burden off. They're in the driver's seat. We're just gathering the information, providing them with that information and, assisting them with anything further that they may need. We're asking, do you want us to help with, warm handoff communications, home assessments? How can we help you? So it's really trying to take as much off of them as we can. Knowing that,
well, you do the math and say it takes an hour to get somebody to talk to you meaningfully about the family situation, and they have multiple files. They can't do that. There's just not enough time in the day.
No. Yes. And I mean, some of our families we're finding 90 to sometimes 100. We found like 100, 110 people. And that's a lot of people to attempt, and we're calling and we're emailing and we're reaching out by any means that we possibly can.
Yeah. And do you have anything to add to that from your perspective?
Yeah, I think we also take the administrative burden off. It's a federal requirement to do family finding, family connect, family engagement, whatever term you wish to use. It's a federal requirement to do that for child welfare staff.
Right.
They have to document that they have done that work. They have to show that they've done that work. We provide that to them. So we take some of that administrative burden off of them by providing them with all of the detailed information they need to satisfy that requirement as well.
So even some of those T's that need crossed and I's that are
Correct.
dotted, you provide some of that.
Even for court requires those efforts be made, and they'll attach our packets to their court work to be able to prove that.
That's great. And what does the impact? What is the impact of the role of specialization?
Yeah, I think I touched on that a little bit earlier when I said caseworkers have the specialization in child safety and case planning. The impact of our specialization in investigation work and our background analyst work and our engagement liaisons is really, one, the quality of it. So when you have a specialization in it and this is what you're focused on, the quality of what you do increases. So the impact of that increases along that way as well.
And, between the specialization roles and the burdens taken off administratively and otherwise, it seems that this provides clarity. And does this clarity reduce bias that otherwise exists within the system?
Yeah, absolutely. So when the system only sees maybe a portion of a child's family. Decisions really are just relied upon what they see. If we're opening up that full story for them, then they're able to make decisions with the full picture and not just that little portion.
Right. And it makes sense. You can only make decisions on what you know. And if without that,
Mhm.
you're making the best decisions you can, but it might be incomplete.
Right.
And this is expanding the information base. All right. So I think we've talked in great detail about how this all sort of comes together to bring information to the frontline workers and allowing the caseworkers to make better informed decisions earlier, which is the key to all this. But let's talk a little bit now about integration. And Ann, I'm going to ask you this question. So how does this Family Connect process anchor other CSI services?
Family Connect's the starting point. So in order for the county to really make true decisions and see what's happening with the case or the family, it's really to get that full picture on the family. Once you have that full picture of the family, you understand those family dynamics, and you have a clearer understanding of what additional support services, resources you may need in order to continue to help that family.
And does this potentially activate other CSI services?
Yes.
Okay.
Depending on the circumstances in that case.
Okay. And what would some of those services be?
So locate services. So if a maybe child goes missing and we have our locate our investigators help to find that child. We have that family network that we can, even search through that kin network that we've already discovered to see if we can help locate that child. So our investigators who are out in the field can then do that work in order to locate that missing youth. We have our field support services. So our field support services with being able to help the counties in doing their day-to-day work that becomes more timely for them. Whether they need a transport, they need that child or youth transported to a visit or to court or to an appointment or to a placement. We can provide that support to them. We have our safety monitoring services. If a county needs an extra set of eyes on a child to ensure that a child is safe in a living environment, we have our safety agents who are able to provide that monitoring for them as well.
And Talina, I think, if correct me if I'm wrong, but what Ann just described with investigating and field and safety support, these are the kind of things that activate with your team as requested by caseworkers?
Yes, they do. The supports are typically activated when a case reaches a point where the agency needs deeper verification on certain things. They might need the field presence, like Ann was talking about, or additional situational awarenesses to move forward safely within that case. And in many situations, the information available through the documentation or phone contact simply is not enough to fully understand what's actually occurring in real time in that case. Child welfare cases often require agencies to answer questions as well that cannot be resolved from a desk. So that's when, our computer software, so that's where that boots on the ground is really beneficial. And just for example, agencies may need a few things to verify who's actually living in a home. They might want to know that, determine whether a relative is a viable support. Like Ann was talking about our locate of youth who has disengaged from placement, or to understand family dynamics that can't be fully assessed through records alone.
And I got to imagine you get that phone call often where someone's like, Talina, tell me about this case. Tell me about this kid.
Mm-hmm. Yeah, we do.
Yeah. And that handoff of information sometimes is like, I'm under a crunch. Tell me what's going on here.
Yes.
Yeah. And Ann, can you talk a little bit about the role of investigative support in all of this?
Sure, absolutely. So, investigative support, I think, is crucial and why we made it a necessary part of Family Connect as well. But with investigative support, it really drives down that facts to act that we say. that is where we ensure that the investigators are gathering that factual information that's needed in order for those decisions to occur.
And that's, I'm sure, a lot of guidance from you and your team of saying these are the kind of things we need. I mean, I'm sure your investigators know that after working with you for a while, but they need to know what they're looking for as well.
Absolutely.
Okay.
Yes.
And sort of building off of that, so you have the investigative, but the field-based supports, how do their roles play into this as well?
So the field-based supports, as I said, the counties will utilize field-based supports in a number of ways, whether it is to locate a case participant because they need to interview that individual for a reason, or that individual might have information regarding the family that they find crucial. They'll have our team look for and talk with that individual, whether it is to gather records, whether it is to trying to think of some other things, gather records, do door knocks, do safety checks, do make sure that who's all living in the home, as Lena had said. It's just a piece to the big puzzle that we do.
And you do all this work, better decisions are made about where to place this child and put them in the best situation possible. But you still have to follow up. How does safety monitoring play in some of this?
Yeah, so safety monitoring, the counties will ask that we give them an extra set of eyes. The county might have information that someone's residing in the home that maybe should not be in the home, whether it be a tier 3 sex offender or whether it be someone who's prohibited by court order to be in that home. The county will ask us to provide that extra set of eyes to verify that this individual is or is not there.
So you don't leave the process once you hand over the information. You're there making sure that those decisions were the right ones.
Correct.
Okay.
And the most important thing is giving that information back to the county so they can make decisions based on facts.
Okay. And it sounds like a lot of this, Lena, is strategic, and it's strategic use of these supports. Can you just touch base on that for us?
Absolutely. So what is important for that is for leaders to understand that these supports are not activated within every case, and that they're used strategically, like Ann was talking about, when additional capacity or expertise is needed, or field presence. That can help the system better understand what is actually happening in the child's environment and what is going on firsthand to make better decisions.
Makes sense. Well, we're coming towards the end of our podcast here. We covered a lot of information, fascinating, and it's very impressive to me, the work that you both do. But let's wrap this up with a few closing questions. So, Ann, I'm going to start with you first. If a leader could improve one upstreet breakdown tomorrow, what should that be?
Oh, that's easy. Early visibility. And I look back at my child welfare days and think about opportunities that I missed as a child welfare worker, as a supervisor, as a leader, and that was not focusing more on early visibility to give you that full picture of that family network that's surrounding that child. If you don't start with early family visibility, you're working downstream. And that's pretty much how the system works that we see every day. If not having that family visibility, you have placement disruptions, you have delayed permanency, you have overwhelmed staff. And just thinking if you had that from the beginning, how many changes could have happened in the trajectory of that case.
And I think it's abundantly clear after talking through this that early information is critical. But Talina, what is it the system often knows at the beginning? And I think that ties it back to saying that's the best scenario we could ask for, but what's the practicality of what you're seeing without it?
So what we're seeing is when a child first enters care and enters the system, agencies often know very little about the broader family network and about the circumstances that have really been occurring. Workers may know immediate household, like Ann was talking about, but many other important connections that could be made for that child are often very invisible. Those might include the paternal relatives, like we talked about, grandparents, aunts, uncles, family members, or other supportive adults such as teachers, coaches, neighbors. We talk about neighbors. That child might have went there often for dinners or for lunches. So it's at that exact moment that the system knows the least about the family network. It is often making some of the most important decisions of the life of the case.
And Anne, when this visibility does improve, what can we expect to see?
We can expect workers to have more options.
And so, Anne, what happens when this visibility does improve?
We see the system becoming stronger. We see workers having more options for placement decisions. We see children having better connections with their kin. We see permanency conversations happening earlier. As leaders, I would say leaders probably have better information to determine if the decisions and the resources that they're investing in are actually working.
That makes sense. And we are pretty much at the end of our podcast. Anne, do you have any closing perspectives you want to give?
Yeah, I would say that child welfare will always involve complex, difficult situations. That's not going to go away. But I think when systems can see the full picture, when a child enters care, that if they have that full picture, then better decisions are being made. And ultimately, that's what every leader in this field is trying to achieve: is better decisions being made, having that factual information, and really having systems work thoughtfully rather than reactively.
Makes sense. Mm-hmm. Well, Anne and Talina, I want to thank you both for sharing your knowledge and the important work that you both do.
Thank you.
So, as we've discussed today, early family visibility isn't simply about identifying names in a database. It's about reconstructing family systems in a way that supports relational practice, reduces administrative burden, and strengthens defensible decision making. When family discovery happens late, systems react. When family clarity happens early, systems stabilize. In our next episode, we'll expand this conversation to a leadership level, exploring how investigation, engagement, and data integration must function together upstream. We'll talk about governance, technology, and how systems can scale early family visibility without restructuring authority or adding permanent staffing. Thanks for joining us for this episode of the Intel Brief, CSI providing the facts to act. If this conversation resonates with your work, we invite you to continue the dialogue and look forward to exploring the next chapter with you.